everybody, it's me, Dr. Kevin Stevenson. Thanks for joining me on today's episode of I Don't Care with, me, Dr. Kevin Stevenson. Always appreciate you joining me. I think you're really going to enjoy today. I say that all the time, but I really mean it today. My good friend River Meisinger from AMN Healthcare is with me. And River and I have known each other for quite a while. He's helped me with a lot of searches. And we talk monthly about what's going on in healthcare recruitment and healthcare in general. So, River, welcome to I Don't Care.
Thanks for having me, Kevin. Excited to be here, and Friday helps us, and a little bit more exciting as well.
Absolutely. River and I were just talking about, both of our brackets are busted here in March Madness. Not too pleased about that. I went out on a limb and picked University of Houston after seeing them trounce my Baylor Bears here locally. River, you picked Houston too? Is that what you said?
Yeah, no, I had Houston in it, and I'm not trying to hide the basketball back there, but I have allegiances here too as well. So exciting to see. It's been a great bracket as usual, right? March Madness by the name. But absolutely had Houston kind of going to the final dance, and it'll be exciting to see. Good to see Illinois there, and clearly Arizona's playing good basketball. So we'll get to see kind of how we wrap up.
Yeah, I totally agree. I got to see Arizona in person too, and they're a force to be reckoned with as well. So, but basketball is basically over now, and so baseball kicks off, and so I'm pretty excited about that. I don't know if you're a big baseball fan. I'm a huge Rangers fan. Don't fault me for that. Been a Rangers fan since they moved to Arlington back in 1972, but really looking forward to the long Major League Baseball season.
We loved having the Royals here in Kansas City. Been a little while for us, but good to get to see the talent continue to develop on the team. And I know every Kansas City resident is always excited about Chief season right around the corner. So lots of exciting announcements with potentials coming to the team next year. So as always, Kansas City sports are always a passion, and looking forward to getting out to the K to spend some time here over the summer.
Yeah, absolutely. Well, you've got a kid that I watched grow up whenever I was in the Dallas-Fort Worth market, Bobby Witt Jr. He can play a little bit of ball.
We love having Bobby Witt. He's one of those icons. Going back to me, we've had some icon players, but Bobby absolutely is that for the Royals, and he is kind of the Mahomes or Travis Kelce of Kansas City when it comes to baseball.
Oh yeah, absolutely. Well, we've beaten our sports up for a little while. Let's get into healthcare. River, what are you seeing? Recently in what are the trends in healthcare recruiting? What are the hot positions, hot regions? Give my audience some of your insights.
Excited to be here, Kevin, to spend a little bit of time talking. It's such an interesting, COVID, pre-COVID, post-COVID, however you want to say that, I think continues to be a lot of the conversation at AMN and just in general as we think of the industry. The shifts as we've looked at coming out of post-COVID, both I think reflect some of the generational changes in workforce, which we'll probably spend a bit of time on today. I think also reflect burnout, especially on the nursing side, talent pipeline ability, right? As we think of some of the allied clinicians, that's a hot topic right now as well. Getting into the provider space, and as our dear friend, I think Scott Becker and team shared, the APP and physician space, to be specific when I say providers. Looking at the next decade, I would say for APPs and physicians, you're 180,000 plus or minus, and that's just a pure statistic, right? So when we think of what does that mean for the systems on a day-to-day basis, not used to that, right? And then, even if we go further upstream to look at leadership, all of these things are not only being driven by generational effects, by, let's say, burnout. We also have this great generation of incredible clinicians, physicians, leaders that are getting ready to transition to retirement. And so I think that the topics of workforce right now couldn't be more important. And as we kind of talk today and unpack just a little bit, some of those hot topics are going to specifically reside within the physician APP allied space. And then how are we looking at talent pipelines for the future? What are we doing there? And I think a lot of systems today are spending their time getting more ingrained in how do we plan early? How do we start to use data and analytics and AI, not to use that AI word we all hear all the time, because ultimately that's how we can get to sustainability or optimizing our workforce. And that's really where I spend most of my days every day talking to health systems.
Yeah, it's amazing the conversations that I've had just over the last few months about, and you and I think we both agree on this. Healthcare has never been really good at succession planning at all. And now we're coming up against a cliff where a lot of our senior leadership are, in their 50s, 60s, and looking around to see, okay, who's going to come in, after me and continue this work. And there's a little bit of frustration and frankly, a little bit of consternation in and around that. And so I think, and I was just at ACHE Congress earlier in March, as were you. And I talked to a lot of the university programs, and there's some concern there because of the large system consolidations and just the financial pressures that systems are seeing. There's fewer residency slots available for MHA, Masters of Healthcare Administration students, MBA students, or whatever. Are you seeing that same thing?
You are. Yeah, actually, it's interesting you say that. Kind of thinking of starting with leaders, right? Both the attraction, right, of how do we get students interested? How do we move back? I think a lot of this goes back to not even high school, right? And we see some of these talent programs, starting to look at dedicated schools. But from a cost and financial pressure standpoint, the residency spots, the cost, right, for looking at, having a administrator or a fellow or whatever you want to call them, they aren't as high. It's interesting. Some of my, let's say, extracurriculars, KCLPC, we do a lot of work between Kansas and Missouri for ACHE. We've recently been having this conversation because not only does it impact our systems, then if we go even further downstream, we have rural hospitals, and how are we developing talent there, right? So I think there are some right now looking at, could we even look at shared, fellowships or shared administration rotations, because ultimately, I think we are seeing less and less spots, which is interesting, right? Because when we get to then the pieces of the throughput of needing leaders, we don't have enough. And I think the other piece I would add on there, Kevin, is our systems keeping fellows. One thing I continue to see in some of the best and brightest systems I see, even going to ACHE, it's great to see those systems that bring their fellows. But it seems most fellows come to the end of their fellowship and we're not retaining in the system, right? It's okay to get diversity and experience in other systems, but that talent pipeline is a great place to start. And I think there's probably opportunity I see. I don't know if you see that as well as I look nationally.
Yeah, I really do. And I think another issue that's coming about is, the compression in the C-suites and in those roles that are typically the preceptors for residents is such that they just don't have time to put into those students like they did, 2 to 5 years ago. And so I think a lot of the students aren't getting that rich residency experience that they used to get. And so that's something. But you do bring up a really good point because of financial pressures and because of systems really going so lean, they can't even retain a quality resident, and that's unfortunate because looking at the pipeline, looking at, you touched on the topic of getting young people excited about healthcare again, because let's face it, COVID did a number on our industry because pre-COVID, people thought, hey, I go into healthcare, I'm going to have a job for life. It's going to be something that I find rewarding, that I'm called to do. But COVID hit, and it really exacerbated the fact that, what, healthcare is a hard industry. It's hard work, and it's not only mentally taxing. If you're a frontline caregiver, it's incredibly physically taxing, and then COVID brought out the emotional side as well. And so I think it really turned a lot of kids off that may have considered med school, may have considered going to nursing or any of the ancillaries, or as I said, even into hospital administration or healthcare administration. And so we've got to rebuild that trust with students. And part of that trust is, hey, if we bring you on as a resident, we're going to retain you and help you grow in your career. But we've got to look at other aspects too. And I love the fact that you brought up high schools, because that's something that we're really tapping into here in Central Texas, is going to the high schools and bringing students into the hospitals and clinics and other healthcare venues of care, and really showing them, hey, yeah, it's hard work, but look at the rewards that you get and look at the opportunities that you can have. So
yeah, it's important. We generationally need more than ever, right? It's statistically, not only are we short on providers, but with our population growth and aging,
yeah,
the demand, right? As we look at this shift into the ambulatory space, we don't have enough beds, right? And in a space today where inpatient services isn't where we want to be, and so the demand, the need for care isn't going anywhere. And so it's interesting, right? While we talk about these challenges, one thing I continue to see with resilience is the passion for healthcare clinicians, for peers.
yeah,
While we do see some of these gaps, I was talking just, in the last 2 weeks with somebody that, couldn't be more excited just because of the challenges and opportunities that sit ahead of us. And, just taking a quote from another, HR executive recently, as we think of AI and how does that come into this, right? This doing more with more, right? So the ability to flex, shift, and be able to look differently. I think the one thing that is resilient as I look at any of these categories is change is here and change is constant. Status quo, as we look at operations from where it's been, is just not going to be, it's not going to lead us forward, and it will be really challenging with the financial landscape we're in right now.
Yeah, no, I agree. And now in my work as an advisor, you bring up AI, and you're exactly right. Yeah, it seems like every company that I'm advising now has that AI component, but it's not like the rise of the machines that people start thinking about. AI is going to take over the world. AI is going to take over my job and all that. It's really it's looking at it from a perspective of how can we make you more efficient in what you're doing. I'm working with people who are doing inbound, outbound call centers AI. That allows what in the past was could have been a war room full of people. You can winnow that down and then redeploy those people into other things. Then you start talking about revenue cycles. Same thing. You're able to redeploy people in a more efficient manner. But those are just two areas. But it seems like every area that I'm working with is trying to get more efficient. But here's the thing that kind of concerns me. In a lot of organizations, gaining that efficiency means laying people off and not redeploying them to another area that really does need more human bandwidth, that can't be necessarily led through an AI driven platform. What are you seeing about that?
I mean, I think you're hitting on a lot of key topics. When every room I could go into, it doesn't matter if it's a hospital and conference, the connection, the conversation around AI, it's interesting, right? We see tools like ambient listening, and how have those enabled pajama time, right? As we think of where do we get to top of license. I've seen some of this as we think of looking at registration or patient access, right? So how do we pick the right pieces where tools can be deployed? I think one piece, layering in again, as we think of where AMN is in this, right, is I think starting with a plan, right, enabling technology. One thing I talk with systems constantly about today is, and especially in the provider space, do we have a plan, right? When we're coming in to think of gaps, if we've got your OB clinic and, we're looking across that OB clinic at a subsection of providers, do we know where they're at in their career? And statistically, right, we know the age ranges, but have we looked at that? No. And likely probably 60 to 70% haven't. And, from there, if we have or haven't, if we kind of look at that subsection of, let's say more than 50% are within age range of retirement, are we recruiting, right? If we have a provider pipeline for permanent roles coming into a system, we might be 300 plus days, depending on where you're at, to look for that same provider. So that same partner, right? Have we started to look at that, right? Because then going to the point you're saying, to the provider space, it's how do we deploy plans early in planning? The great thing with AI is that it can, in technology, give you a centralized view. So we're not having to go source data out of multiple systems to make good decisions. And then ultimately, the benefit in the conversation around APPs and physicians is then we're planning long-term to optimize your labor, right? Dependency on locums, dependency on travel is not the answer. Yeah. And Kevin, I think that is an example. Your other question, right, around layoffs. No, I think if we're planning well, coming back to the same conversations around statistics is we need to redeploy labor. Because going back to that same concept of doing more with more, there's just simply not enough. So if we think of, even great pipelines, great programs with schools, the faster we can plan to look at how do we find top of license, how do we find sending or training new skill sets, that's going to be the need that we have because there are just simply not enough people. So when I hear AI, it's exciting to me, but I think the blend to make it perfection means that we have to have that human enabled pieces. It's not an option. And, kind of to your point, when we talk about, how do we retain residents? How do we retain providers long term? I see innovation happening, right? We see, some of the things I'm seeing in the MDDO space is, generalist is not the answer. Everybody wants to be, a interventional or some sort of specialist, right? But a lot of systems now are looking at different innovative ways to keep fellows on payroll, right? Radiology is a specialty that's incredibly challenging, right? But we've got, fellows going into other systems. How do we keep them reading? Because we don't have to have this concept of being in the four walls. We just need to make sure from a state-wise that makes sense from a regulatory standpoint and employment basis. So I think the answer to some of that is, without unpacking, we could talk about this all day, is it has to come with planning, it has to come with innovation, and it's always doing things not quite the same way every day.
Yeah, River, and you bring up a great point about planning, because I can tell you at my last hospital, within the first year, we did a full physician needs assessment. And I was looking at that, and I knew exactly what we needed over the next 5 to 10 years from a physician APP complement. The problem was, how do we get them to come to our hospital, our market in Central Texas, that covered 500,000 people. that had a very robust tertiary care market with two very fine hospitals of similar size. But how, you've got to start incentivizing differently. You got to start thinking differently, because the people that we lost, we were losing them to the major metropolitan areas, because the providers felt either A, quality of life was better, or B, they can make more money. So what are some ideas and thoughts around, the mid markets? How can they better recruit and retain, not only providers, but also leadership as well?
Yeah, it's interesting. It's a great question. I think partially, and Kevin, really, as you started today, right? We've had the opportunity to work together. So,
Hmm.
when I think through, some of the things of just even looking at Waco, or Baylor, or communities, mid market, doesn't matter what it is. The pieces, as I kind of think through, what a partner looks like. I was talking to one of our recruitment leaders today. Their talent pipeline, actually, in the physician and APP space, is quite strong.
Mm,
They are doing well from a presentation standpoint. What we see, I think, at times is, how do we bring best practices? So,
yeah.
not maybe going back to the planning discussion, but then what is the partnership? So it doesn't
Mhm.
matter if we're talking about a leader, doesn't matter if we're talking about a provider. I think from scale, making a plan early is to say, and that's really our approach. From how do we become a partner or an extension of you in that conversation? Have we done a really
Mhm.
good job from internal recruitment, whether that be providers or talent acquisition, to cover the local and regional markets, if I'm a mid market, to make sure
Yeah.
that, is there a challenge down the street where we created dissatisfaction. I think for mid markets, another great story to be telling right now is, um, you look at mergers, right? Mergers and acquisitions, these
Mhm.
systems are growing. When I think of some of the
Yeah.
generational trends that we see, both in physicians or clinicians or leaders, they want to be a human. They don't want to be a number. So if I'm a mid market right now, culture matters, right?
Yes.
Not be tangible again, but the ability to actually differentiate on culture. I think bringing
Mhm.
in a partner that can give you benchmarks to, hey, if I placed, if I've got OB roles, or I've got neuro roles, or AP roles, what are the
Mhm.
last 20 systems you've seen make successful hires? Was it in a sign on? Was it on, working on a longer, reimbursement of some sort of loan? What are the structures that you're setting up to create success, and how do I key and differentiate that? And then I think the other and third prong of that is the ability to make sure that, if I am a system, right, that doesn't have a national presence, I have a national partner that can go and sing my praises, right? So that partner has to understand
Mhm.
me. They have to know culturally what's different to be able to engage and push for success, because they're going to draw in talent that's maybe not thinking about Waco, or maybe isn't thinking about Kansas City, or maybe isn't thinking about Des Moines, Iowa. And then at the same time, we need to make sure that the experience is great. If we start with that plan, that first interaction, whether that be with talent acquisition, whether that be with, the medical director, whether that be with a leader, we want to set that experience up so that the experience works and flows through. And then as we get into on sites, if we're talking about providers, if we're talking about leaders, I always encourage, how do we
Yeah.
differentiate your community? Which means on sites are crucial. It sounds old school, but we have to understand that. I think back to a system I worked with, partnering with another partner in the industry. They never came to town, never took the time to kind of understand they had a bed and breakfast, right? So we're recruiting neurologists and putting them up in
Mhm.
a Super 8, um, and or they're driving in 2 hours and 40 miles of traffic, because we didn't take the time to understand how to showcase the community. So I guess if I was to pull on all three levers, I think if I'm a mid market, I want to differentiate. I want a partner that can understand me. And then if I have done a good job locally and regionally, how do I open up that funnel to look nationally to say, I'm able
Yeah.
to lean on them telling my story and trust that they are going to partner to do that.
Yeah, I mean, you're exactly right. I mean, whenever we were most successful in bringing in providers and clinicians, it was by promoting the culture. Yeah, okay, I'm about to go, go all old school and get off my lawn kind of thing, but our most successful hires were, were based around if mama ain't happy, nobody's happy. And so we spent so much time on that on site with the spouses and husbands and wives, and really showed them what Waco and Central Texas had to offer. And that was really the big selling point for us was, hey, Waco's an up and coming community. We do have the proximity to a Dallas Fort Worth, Austin, Houston, but the culture of the facility was outstanding. And so those are the things that we saw that were the most successful for us.
Yeah, I mean, Kevin, you nailed it. It is those nuances, right? First job experience matters, qualifications matter, right? All of these things have to be there. But family, the support system, the why, the differentiators, what are the going to be the motivations there? And ultimately, you're building your base. I think if we ask most that I spend time with in the physician and APP space, they're going to be your loudest champion, right? If we're bringing in great docs that love the community, love working in systems, or great leaders, their pipeline follows them. So taking the time early, investing the time early is going to be important. Those are the intangibles. And then having a partner that can give you the data, that's going to be how you differentiate to make sure that market competitiveness and the ability to go to market and create differentiators.
Yeah. Well, in the last few minutes that we got, I definitely want to touch on our newer workers, the Gen Z folks. And I was sharing with you beforehand, I received a survey yesterday, and it really caused me to think a lot about those Gen Z, and I looked it up to make sure they were classifying Gen Z as those born from 1997 to 2015. So we're looking at those, under 30s, the early careerists. And I got to say, I've had a string of phenomenal administrative residents that have gone on to do tremendous things in their careers at a very early age. But as I shared with you, I had the cream of the crop, and frankly, working with some Gen Zs that weren't as focused was frustrating. So what are you seeing, and how can we as healthcare leaders do a better job of setting those expectations and really bringing these new leaders along that we need desperately?
Yeah, it's interesting. I alluded a little bit, right? Workforce transition doesn't matter, leader doesn't matter, provider. I think generationally we are seeing a shift, and it's not shifting completely. Of a balance of life and work, however you want to look at that. We look generationally back, and healthcare I think tends to represent this well because it's a 24/7 business. There really aren't days off. At a generation that was very driven to only work. When we balance some of the newer generational skills, right, I think it's to work hard, but then to balance having extreme work-life balance to do things they love. And it's interesting. I would take just a few snippets, right, of first off, how do we make a shift in which the demand is so high to find ways for that, right? And I think having the conversations early is important. When we talk of some of the humanizing or characteristics around what does that look like, this generation is incredibly savvy as we think of technology. But I can give examples, right, or an endless, countless stories, right, where we have brilliant clinicians, nurses at the bedside, but maybe just tiny mistakes just based on they haven't spent a lot of time with people, not a phone, right? So how do we find time to engage and teach some of those back to basic skills, and or find places to meet in the middle? And then, I think back to an example recently that is, I was sitting in the room with a CHRO, and we were talking about the same topic, and she said, "Yeah, I had a nurse manager, and we had two roles open, a CNO role, and I think it was a VP of operations, right? And she's a month into her career. I've got 5 applications from brand new nurses that are ready to, interview for this role, right? And so I think the general instinct at times is to just say, well, no, right? But in this case, I took a moment to just go to them and say, so, well, why? What made you interested in this role? Why did you apply? What did you think? Right? And the feedback, and again, I think you can't generalize, but there are opportunities to think through was, well, I want to grow, but I don't know how. And so I think part of this again then becomes, how do you make a plan? I think we have a generation that is very interested in growth. How do you make those plans early? How are you training, teaching, listening? And then I think there's a balance, right? Some of the communication styles, there's probably a way to meet in the middle of some of those things. And every system's going to find different ways to do it. But I absolutely agree with you that we have a generational workforce shift that is coming and changing. And they're going to challenge us to do things differently, ultimately, because there are not enough others, right, to be a part of that. And it's going to push us right in the direction as we look at AI and some of these other things that format look at.
Yeah. Well, I think it also gives us, those of us in senior leadership roles or seasoned leadership roles, it gives us the opportunity to share some of our experiences and really mentor these. And oftentimes when people start talking about mentorship, they're thinking, oh, it's just one way. It's not. I've been blessed with some great mentees throughout my career who have taught me a lot more than I ever taught them. And so I think the willingness of senior leadership and really leaders throughout healthcare to invest in those coming up in our industry, but also to be willing to learn from them too, because as you said, they're much more technologically savvy, and they do have that real focus on a work-life balance that some of us old hands probably could have used early on too.
Hey, you said it well, and you didn't pay me to say this, but I'm impressed, right? I think the importance of mentoring our younger generations coming into this, that's our future. That's where there's right? It couldn't be any more important than that. There is such a gift, and there is such a knowledge of the resilience of the leadership, of the providers, of the clinicians that are here today, to say, how do we pass that on? Because ultimately, there's no more important time as we look to the future of the need of brilliant clinicians, brilliant leaders.
Yeah. Well, hey, River, the time has flown as I knew it would between the two of us. So any final words that you'd like to give my audience?
No, Kevin, what I appreciate is that you're taking the time, right? I think it's good. These dialogues happen in rooms. I see them all too often. Mm-hmm. But the ability to listen, to learn from best practices, and getting to kind of look back and follow your conversations. I love the humanistic characteristic, the lack of having a script. And so, what I'll say is, I think, again, going back to that, that doing more with more, that's resonated with me a lot recently. It is challenging, but I continue to be impressed with healthcare as it's connected to me, but also the clinicians, the leaders, the providers doing the work every day. There is still such an intense passion, and I think the service orientation is one that just comes out and is easily recognized.
Yeah, I totally agree. Well, River, thanks so much for joining me. It's been great. Folks, River Meisinger from AMN Healthcare. Again, I guess my final word is to really invest in those with whom you work, whether they be subordinates or peers or even your bosses. Invest in those people, and when you do that, your organization as a whole runs just a lot better, and your patients get better care. So with that, I'm Dr. Kevin Stevenson. Thanks for joining me on I Don't Care, and we'll see you next time. Take care.